Hi, good evening. Welcome and thank you for attending tonight. I'm Laurie Trungone. I'm the Assistant Vice President at Inspira for Women's and Children. And as usual, I'm bringing you a Spirit of Women event tonight. We are very lucky to have two of our Inspira Medical Group providers with us. But before we begin, I'd like to go over a few of housekeeping items. We're using a platform tonight that has lots of fun bells and whistles. We've used it a few times already, and we really like it, and we hope you do as well. Feel free to click around and explore your screen. There's lots of things that you can do. You can look at the bios of our providers. You can look around and do a bunch of different things, including make an online request for an appointment right on your screen. So we're really excited about this platform. All the windows on your screen are resizable and movable, so feel free to move them around, make the most of your experience. You can enlarge the slides by clicking on the arrows in the top right corner, so you can really customize it to make it look and feel the way you would like to. At the bottom of your screen, there are multiple engagement tools that you can use. Using the toolbar, you'll be able to download the slides and other resources. You can, again, I mentioned, look at the speaker's bios. You can even register for our next event. As usual, we encourage you to ask questions throughout the event using the question and answer button. We will attempt to get to all of your questions. We do leave time at the end to do that. Your questions will only be visible to us, and you can remain anonymous if you want to do that. You can certainly leave your name if you want to, but again, if you like, you can be anonymous. We want you to be comfortable and ask whatever is on your mind. So if that's what you need to do that, please go ahead and do that. Throughout the presentation, you'll see we'll have poll questions that will pop up. All your responses are, again, anonymous, and we encourage you to participate. It's what really makes this fun. And to answer your question, yes, the presentation is being recorded, and an on-demand version will be available tomorrow using that same audience link that you're using for tonight. So let's get started. It's my privilege to introduce our panelists tonight. Dr. Neely Alicia is a board-certified obstetrician and gynecologist. She earned her bachelor's degree from Barnard College at Columbia University in New York, New York, followed by her medical degree from the University of Medicine and Dentistry School of Osteopathic Medicine in Stratford, New Jersey. She then completed her residency training in obstetrics and gynecology with us at Inspira Medical Center in Vineland. Dr. Alicia specializes in the diagnosis and care for all women's health concerns, including several preventative services, female reproductive care, infertility treatments and counseling, and other regular routine screenings. We also have with us tonight Dr. Samantha DeLuca. She's an obstetrician and gynecologist at Inspira Medical Group Obstetrics and Gynecology in Mullica Hill and West Deptford. She earned her undergraduate bachelor's degree from the University of Pennsylvania and her medical degree from the Philadelphia College of Osteopathic Medicine. She completed a residency at Christiana Care Health System in Newark, Delaware. And in 2009, 14, and 19, she was named Top Doc in South Jersey Magazine. And in 2011 and 13, she received the Compassionate Doctor's Recognition. She has a special interest in menopausal medicine, infertility, and medical and surgical intervention for endometriosis. So that's very exciting for us. So whether you are already pregnant or planning on getting pregnant, there are many changes that your body goes through, many things that you're going to feel and experience during your pregnancy. Many are normal and expected, and some are not. We'll go over both the expected and some of the unexpected changes so that you can be better prepared and know what to expect. So we'll start with Dr. Alicia, and can you review for us some of the common symptoms that women experience during their pregnancies?
Of course. So one of the common symptoms, well, there's many symptoms, but the first period, of course, the first sign that you're pregnant most of the time. And so a lot of women come to the office when they miss their period, and that's how they find out that they're pregnant, or they take a pregnancy test at home. Another common symptom is headaches. Headaches are very common. You can get them, some women get them every day for a while. You can take Tylenol for it. It usually goes away with that. If you ever have a situation where the headache seems to be getting worse, not getting rid of Tylenol, you might want to call your doctor. It's due to the change in hormone levels and blood volume. Then there's spotting, which which means just a little bit of vaginal bleeding, and that can mean several things. Most of them are not a big deal. For example, implantation, meaning that the embryo implants in the uterus, that can cause some bleeding a couple of weeks after the fertilization. It can also mean like a small vaginal infection, or often the cervix, because of the hormones, gets sensitive and friable, so it can bleed easily, sometimes after intercourse. It can also mean something more serious. Early in pregnancy, it might mean a miscarriage, not necessarily. So when there is bleeding, you should call your doctor, especially if it's associated with pain, like belly pain, cramping. Weight gain. I don't know if this is so much of a symptom as just like the whole pregnancy, right? Everyone expects to gain weight. It's usually 1 to 4 pounds in your first pregnancy, and it becomes much more noticeable later in the pregnancy. Women start to show typically after 20 weeks. The uterus is getting bigger and gaining more weight. Heartburn. Heartburn can be pretty significant and can start early in the pregnancy. It's due to the relaxation of the valve between the stomach and the esophagus, and it's because of the hormone changes in pregnancy. Pretty much everything is due to the hormone changes in pregnancy, by the way. And when the stomach acid leaks out, that's when you develop heartburn. And you can take Tums for it, by the way, and there are other medicines you can take if you need to. Constipation. It's interesting. Constipation and diarrhea are both possible symptoms due to the same hormone changes. So someone will have constipation. It could also be because of iron that you're taking if you're anemic. You get constipated. Diarrhea, again, hormone changes. If you have it for several days and it's not going away, you probably should call your doctor. It could be something else. Just because you're pregnant doesn't mean everything is caused by the pregnancy. Just probably everything is caused by the pregnancy. But you should check if you're not sure. Cramps. So as the baby's getting bigger and the uterus is getting bigger, there's a pulling sensation, there's ligaments, and everything stretches, and that feels like cramping. If it gets severe or if it's associated with bleeding, you want to call your doctor. Back pain, very common because, again, hormones. It relaxes the muscles and the ligaments, and you're growing a person in front of you, and you have a lot of front-loaded weight that you're not used to, so your back is trying to compensate, and it's going to hurt. I recommend massages. You can also try Tylenol. Heating pads is not a bad idea either. But really, the cure is having a baby, and that can take a little while. Anemia. So that's when a woman's iron is low, and it's sometimes just anemia of pregnancy. There's no good explanation for it. But the symptoms of anemia are you could feel dizzy, exhausted, although exhaustion on its own is a symptom of pregnancy, so it's not necessarily because of anemia. We do check with all the initial labs at the beginning of the pregnancy your iron level, so the doctor will tell you if you need to take iron supplements or not. Sorry. And there's depression, which is a very, very common in pregnancy. 14 to 23% of all pregnant women can develop depression. It's not something to be ashamed of. It's something to come to your doctor about because, again, there are medications that we can help you with. Sometimes you don't need them, but if you do, don't try to avoid it. Insomnia. Insomnia is when you can't sleep, either because you can't fall asleep or you wake up and then you fall back asleep. And there could be many reasons for insomnia. Stress, physical discomfort because you can't figure out a good way to sleep because you have, again, a big person in front of you. Or I guess a little person. Eating. So how to deal with insomnia? It's really just good sleep habits is your best bet. You want to not eat and drink a whole lot, like for an hour or two before going to bed. You want to, maybe yoga stretching is a great idea. You can also take a hot shower. And I know this is hard, but try not to watch too much TV or watch or play games and stuff on your phone because that screen, the light from the screen does mess with your sleeping cycle. I know it's hard, and I might do it myself, even though I know I shouldn't, but you shouldn't. Acne, again, the hormone changes, it will clear up. It's not, you can use the counter like cleansers, like benzoyl peroxide. It's actually okay now. Just not sure how much it'll help. It'll just be there. And that doesn't have, these things don't all happen with all pregnancies, but you just don't know which ones will. So be prepared for all of them. Hip pain is, hip pain can happen just like back pain with hormones, extra weight, everything's shifting. Breast changes are pretty common too. They'll get bigger as they're getting ready to feed the baby. They'll get swollen, they'll get sensitive, the nipples become fuller and darker. Some women, actually, this is the first symptom, and they know that they're pregnant just because of their breast changes, which I always think is very interesting. And if there is a discharge and it looks like milk, it is probably milk. And that can happen in the first trimester.
Wow. Very good. Thank you. So, morning sickness. This is a poll question for our audience. Morning sickness is nausea and vomiting that occurs only in the morning. And let's have you answer that, and then we'll answer it for you. I'll give you a couple minutes to answer it, and then we'll go through it. Okay. So our audience answered false. 100% of them answered false. So Dr. DeLuca, we often hear that people say they're in the first trimester, the second trimester, the third trimester. Can you help us understand what those terms mean, and tell us about if morning sickness is just in the morning?
Sure. So the first trimester goes from week 1 to week 12, and really we count the pregnancy from the first day of your last menstrual period. So that actually, if you think about it, that starts the pregnancy before you actually become fertilized 2 weeks before, but that's just the convention that we use. Week 1 to week 12 is when the fetus is beginning to develop. The brain, the spinal cord, the organs are starting to develop. And that's why it's so important, if you're planning pregnancy, to consider a prenatal vitamin before you even start to get pregnant, because vitamins contain folic acid, and that helps close the baby's spine. So it occurs so early, it's important to get that prenatal vitamin going. The baby's heart begins to beat, and around week 5, you can see the baby's heart beating. During the first trimester, however, the probability of miscarriage is quite high, higher than you would think. About 1 in 10 pregnancies can end up in miscarriage, and 85% of these occur in the first trimester. So if you develop signs like cramping or severe back pain, bleeding, passing tissue, or a lot of women describe all of a sudden they don't feel pregnant anymore, their breasts are not tender, or they're not nauseous anymore, you should contact your doctor and just make sure that everything's okay with the pregnancy. The second trimester of the pregnancy goes from week 13 to week 27. Do we have that one? Mm-hmm. Hang on one second.
Okay. Good.
And during this time, we kind of call it the quote-unquote honeymoon period, because, as you approach 24 weeks, you start to feel great. In other words, the fatigue and the nausea and all the symptoms that you had early in the first trimester tend to go away, and you get that pregnancy glow from the hormones, and you start feeling better. People develop what's called round ligament pain during the second trimester of pregnancy, where they have the round ligaments or ligaments that actually anchor the uterus to the front of your abdomen, and they grow and they stretch as the uterus goes above your belly button. And around 20 weeks, 18 to 24 weeks, you'll feel like burning pain or pulling pain. That's normal. Also, like I said, people get that pregnancy glow, and you'll start to feel your baby move around even 14 to 18 weeks. We call that quickening. Feels like a little flutter in your stomach, or sometimes it can feel a little like gas. Every once in a while, the best description of it I ever heard, and I really believed it when I was pregnant, was it feels like when you go over a roller coaster and you go over the first big bump and then you get ready to go over the next bump. And it does feel that way. You'll take your breath away. It's quite a wonderful feeling. The baby will have an anatomy scan at 20 weeks, and that's where you go in and look at all the parts of the baby, the brain, the spine, the organs. Sometimes you can see the sex of the baby at this ultrasound as well. After 23 weeks, a baby is considered viable, meaning the baby could survive outside of the mother's body. However, if the baby's born this early at the threshold of viability, the baby can be, have a lot of health problems. And so the farther you are from the threshold of viability, the better it is for the baby, and the more likely the baby is to be born healthy. In the third trimester, this is the hard times here. This is when you've gained a lot of weight, you feel swollen, you're carrying around a whole human being in there, and really you feel like, sometimes you feel like you're going to pop. You may feel more tired. All those symptoms that you had in the first trimester, fatigue, nausea, heartburn, swelling, all that's going to come back. And the baby can actually sense light and close their eyes as well, and the bones are all formed now. So the baby weighs a lot more, drops down into your pelvis, and sometimes that's responsible for swelling as well, because the baby's sitting on all the vessels that drain the legs and bring fluid back up. So you may actually even feel pelvic discomfort. You feel like you have to pee all the time. You go pee and then you come out and you have to pee again. The baby's sitting on the bladder. And so it makes it really hard to empty the bladder, unless you kind of reach around a little bit. You may have pelvic discomfort or even Braxton Hicks contractions. And you might have heard the term Braxton Hicks, and it really means false labor contractions. Contractions that cause your cervix to open up and dilate and the baby to come out are real contractions, but Braxton Hicks contractions can feel like real contractions. They can be crampy or tight or pressure, but they don't change your cervix, and they're just considered irregular or false labor.
Okay, very good. So the answer to, is morning sickness just in the morning? Is that true or false? Our audience said false. Yeah, so they were correct. So thank you. Let's ask the audience another question. In order for the baby to get enough nutrients, you should be eating for 2 during your pregnancy. I'll give people a minute to answer. I don't think I gave people enough time. So I don't know if I can refresh that. Let me see. Okay, sorry. I clicked too soon. So everybody said false. So Dr. Alicia, is it free reign to eat anything you want when you're pregnant? Our audience thinks no.
And the audience is correct. I mean, eat what you want, but that's not what's recommended. It's really the recommendation is to increase your calorie intake by about 400 calories, let's say. That's not a lot. It's like a peanut butter and jelly sandwich. It's like a snack.
Bagel.
That's hardly a bagel. It's really,
it's not much.
And of course you can eat more, but the problem is that then you will gain more weight and you'll have more to lose at the end. And gaining a lot of weight during pregnancy does come with increased risks during the pregnancy. So really, what should we do? What should we eat? We should have a normal, healthy diet, which we should have even when not pregnant, right? So a mix of complex carbohydrates, proteins, vegetables, fruit, fiber, healthy fats. Don't be scared of the healthy fats. They're good for you. They're necessary. And if you're already eating a healthy diet, you don't really have to change much. Just make sure you're getting enough fluid and eating enough calories. Now, pregnancy is not the time to try to lose weight. That is what's key here. You may not have to gain much, but you definitely shouldn't be trying to lose anything.
Right, right.
It's true.
Thank you. So diet and exercise usually go hand in hand, right? So, Dr. DeLuca, can a pregnant woman still exercise?
Yeah, absolutely. Exercise is essential. Definitely should, if you're doing exercise right now, you can definitely continue that in pregnancy. Pregnancy is not really a time to take up new exercises that you haven't done before. And certainly you don't want to be jumping out of planes or like climbing rock walls, but you can definitely do the exercise.
I would say it's not the time to start training for a marathon.
Absolutely. Some of the good exercises are walking. That's wonderful for a pregnant woman. Yoga and stretching is great, and it also prepares your body for labor, which is great. Swimming is awesome. It's a nice low resistance activity that cradles the baby, so it's a little bit less stress on your joints. You may have to modify your fitness routine. I have patients who, if they're runners, they run all the way up to the end. But some people, if you're rowing or biking, obviously that's going to be something that you might have to modify as you get bigger and bigger in pregnancy.
Very good. So let's go to another poll question. Drinking 1 glass of alcohol is safe in moderation while you're pregnant. True or false? This time I'll give the audience enough time to answer.
Nice.
Isn't that nice of me? All right, let's see. Okay, wow, we've got a really bright audience tonight. Not one person said true. So let's get to that. Dr. DeLuca, why don't you give us some do's and don'ts of pregnancy so we know what we can and can't do?
So it's important to take your vitamins. A multivitamin is fine, but the prenatal vitamins specifically have folic acid and iron in them, B vitamins, and all the nutrients that you need for the developing baby. So it is really important to try to find a vitamin that you can tolerate in pregnancy. Some people do better with, others, kind of a chewable vitamin, or some people do fine with the vitamins that have different supplements in them. Working out, as we discussed, important to exercise, getting lots of sleep. As we had said before, sometimes the physical limitations of pregnancy prevent you from getting sleep. You just can't get a comfortable position. But make sure, as we had said before, that you remove all distractions, don't fall asleep in front of the TV, try not to eat right before bed, definitely no caffeine before bed, and try to enjoy your sleep, because believe me, once the baby's out, you're not going to sleep very much. Eating seafood, we'll talk about that a little bit more with the don'ts, but eating seafood is okay in pregnancy. And we'll talk about eating shellfish, shrimp. That is fine during pregnancy. Having sex, recommended. We knew you have sex once because you're pregnant, so feel free. And it is safe, and it is fine to have sex. You can, like we said, exercise that includes yoga is really good for preparation mentally and physically for delivery, and to improve flexibility, and to also work on anxiety. It's important to get a flu shot, because getting the flu in pregnancy is much more dangerous than getting the flu shot. So it's highly recommended you get a flu shot, and it is flu season coming up, so definitely want to do that. Gaining weight smartly, we touched on that a little bit. Traditional recommendations are 25 to 35 pounds for a woman who is a normal weight. If you are a higher weight, sometimes 15 pounds is plenty. If you're a lower weight, sometimes a little bit more. But
We were talking about weight, right? So, can you hear me? Am I frozen?
Okay, I'm going to move on. Dr. Alicia, pregnancy is a time when you're busy growing a new baby, right? Do you think you can talk to us about some of the bodily changes that happen? Looks like we lost Dr. Luke.
So, yes. So some hormonal changes during the pregnancy, it can be dramatic increases in estrogen and progesterone. And these changes can affect mood. They can also create that glow of pregnancy that everyone loves and talks about so much. Significantly aids the development of the fetus. Estrogen and progesterone changes the increase in estrogen during pregnancy enables the uterus and placenta to improve vascularization, and transient nutrients supports the developing baby. This is an important role in helping the fetus develop and mature.
Very good. We know that, there's a lot of times during pregnancy, women complain about fluid retention, swelling in their legs. Let's just think about what the pregnancy weight gain really means and where does it come from, right? So the baby's about 7.5 pounds, our uterus is about 2 pounds, the placenta is 1.5 pounds, amniotic fluid is 2 pounds, our breasts, believe it or not, are about 2 pounds. You carry a pound apiece in each side, right? We have extra blood volume, extra fat reserves, and that's what accounts for about 30 pounds, which, can be pretty significant. So let's talk about maybe some of the common pregnancy complications. All of that's going on leads us to some degree of risk for complications. So, Dr. Alicia, can you review for us what some of those are?
Sure. So, pregnancy complications they can end up involving baby's health and mom's health, or both, and they can occur throughout the pregnancy and delivery, and even postpartum. Now, some of the complications are not necessarily so significant. Some can be pretty significant for the health of the mom and baby.
Mm-hmm.
Urinary tract infections is a very common complication, and typically it's not a big deal. You feel the symptoms. A woman would feel the symptoms that she feels even when she's not pregnant, like frequency, urinating more often, burning when she urinates, incomplete emptying. She goes to the bathroom and then she feels like she needs to go again, blood in the urine. If you have any of these symptoms, you should call your doctor and get a urine culture and go on antibiotics, most likely. The doctor will be checking your urine at least once or twice throughout pregnancy. And the reason that urinary tract infections are so important to treat is that it could become a kidney infection, and in pregnant women, when they get kidney infections, it could get much worse, and could cause much more significant issues, including preterm labor.
Yeah. So how can we prevent, I guess, and, when do we do that?
All the time you should have good bathroom hygiene is what I'm going to call it. And essentially just drink a lot of water, empty your bladder when you need to. Don't try to hold it. Wipe from front to back is still recommended, because bowel movements does have bacteria in it. If it gets in the bladder, which it does, that's how most urinary tract infections occur. That could happen. But really, there's not necessarily anything you can do to prevent urinary tract infections. If you're going to get one, you're going to get one. If you're prone to it, you're going to get them.
Right. So how about when else we should be seeking medical care, right? Most people have problem-free pregnancies, but some people don't.
Yeah, it would be nice if everyone did, but no. As soon as you know you're pregnant, you should find an OBGYN if you don't already have one. Women who already have medical conditions before getting pregnant, which could be high blood pressure, cancer, God forbid, kidney disease, epilepsy, really any medical condition, diabetes, you want to get that under control. Even obesity, you'd really like to get that under control before getting pregnant, if at all possible. You want to make sure that the medications you're on are safe for pregnancy. You want to make sure you optimize your health so that way your pregnancy will be as smooth sailing as possible.
Very good. Thank you. So, the other big issue during pregnancy is problems with the sugar. We hear lots and lots of people have, whether they're pregnant or not, but particularly during pregnancy when people tend to be a little bit more prone to having issues with their sugar levels. Can you review for us what gestational diabetes is? Dr. DeLuca, are you?
Can you hear me?
Yes, very good.
I don't know, but you can hear me, so that's good.
We can. So if you can tell us about gestational diabetes, that would be fabulous.
Great. So gestational diabetes is a high blood sugar during pregnancy, and it's something that we test for in the 24th to 28 week of pregnancy. Like regular diabetes that people get who aren't pregnant, sometimes pregnant women can have symptoms of fatigue, blurry vision, excessive thirst or excessive need to urinate. But typically, pregnant women are asymptomatic. And the reason we test them between 24 and 28 weeks of pregnancy is because in pregnancy, you actually have a hormone that the placenta secretes that's called human placental lactogen. And what it does is it actually prevents your body from using the sugar that you're taking in your diet. So say, for example, you eat a big pasta meal. What happens is your pancreas secretes insulin and you use some of that pasta, but the rest of the pasta gets socked into your liver so that when you get up at 12 o'clock at night and are watching a movie, then some of that energy will come out of the liver and provide you with sugar to keep you awake. When you're pregnant, you have this hormone that prevents your body from doing that, and your resting level of blood sugar can be higher. And so that's a problem because it can cause problems for the baby. The baby can be big. Exposed to sugar all the time, the baby can gain weight and have a high birth weight. Also, when the baby's born, the baby's lungs cannot be as mature as they should be, and the baby can have breathing difficulties. Sometimes the baby's own insulin will overshoot because the baby's used to being in a high sugar environment. When the baby's born, the baby will have low blood sugar or sometimes even seizures. And one of the biggest things about gestational diabetes and the baby being in a high sugar environment is that sometimes the baby's trunk, like the stomach, grows bigger than the head, and the shoulders can grow bigger than the head, so that when you're having a vaginal delivery, the head will come out, but the shoulders can get stuck. And this can cause issues with a vaginal delivery and the baby having problems.
Right.
So some people are at risk for developing gestational diabetes more than other people. Certainly women who are older, particularly over the age of 35, but even over the age of 25, it's more common. People that also have concomitant high blood pressure are at risk for gestational diabetes in pregnancy. People that have a family history of diabetes or are themselves overweight, they can be at risk. Women that are pregnant with twins or triplets and expecting multiple babies, they have a higher risk of gestational diabetes. If you've had gestational diabetes before or a large baby before in a prior pregnancy, you're at risk. If you're on steroids or you have polycystic ovarian syndrome, and certain ethnicities are more at risk. African, Native American, Asian, Pacific Islander, or Hispanic are more at risk for developing gestational diabetes.
Okay. Well, there are certainly other complications that people experience. Dr. Alicia, can you tell us some of the other things that people need to be aware of?
Sure. So, I mean, there's many possible things that could happen, of course. In the early pregnancy, what most women are concerned about is miscarriage, of course. So like we mentioned earlier, any kind of bleeding, belly pain, you want to talk to your doctor. It's not necessarily a miscarriage, but it might be. Then there's pregnancy-induced hypertension, which is high blood pressure in pregnancy. And that goes on the spectrum with preeclampsia. So preeclampsia is high blood pressure in pregnancy with protein in the urine and other symptoms like headaches and blurry vision and right upper quadrant pain in your belly. That can be extreme, and really the treatment is having a baby. Once the placenta is delivered, usually the disease goes away, but it can end up with organ damage and seizures. So if you have any of those symptoms, and this is later in the pregnancy, after 20 weeks, usually closer to term or delivery or your due date. You want to definitely mention if you're having headaches that won't go away, Tylenol, or blurry vision that seems odd, or just not feeling well, you want to bring it to your doctor's attention. But nothing. That's fine. We are here to hear about nothing as well as.
That's good. People need to know that sometimes they feel like they can't call or they're embarrassed to ask a question. So it's nice to know that you know that you can say, no, that's okay, right?
Yeah. I'd rather you call and bother me in the middle of the night and everything be fine.
That's right.
Absolutely.
So let's ask the audience another poll question. We talked a little bit about sex early on. Dr. DeLuca addressed, sex is normal and expected in the early part of your pregnancy. But what about in the third trimester? Can sex actually injure the baby? It's a question people think about and are often afraid to ask. So let's see what our audience thinks about this, since they're doing so well so far. And then we'll have you, Dr. DeLuca, answer. Oh my gosh, this audience can probably teach the class. Okay, so Dr. DeLuca, many women and obviously men in their lives do worry and wonder about their personal relationships during pregnancy. Is it safe and okay to have sex in the latter part of the pregnancy? Our audience thinks so. So give us a hint about what's okay.
I get that question from the fathers, like, am I going to hurt my child, and actually you're not. The baby is walled off in this big muscle, which is the uterus, and it is completely safe to have sex during the third trimester of pregnancy and throughout pregnancy. And actually the pressure is off because you're already pregnant, so you're not going to get pregnant. You don't need birth control. That's great. Not only that, your hormones are really, really surging. And, women in pregnancy, some women find that the hormones really cause, a desire for sex and their libido goes up. And some women feel that, they're physically limited or they don't feel good about themselves or they just don't feel well and they're not as interested in sex. So whatever is your norm is your norm. We know that the blood volume increases. You have 2/3 more blood volume when you're pregnant. And of course, that causes your breasts to be swollen. It also causes your lower extremities to be swollen, but it causes the clitoris to be swollen. So a lot of times sex is more satisfying when you're pregnant. Depending on where you are in the pregnancy, sex can be better or worse. You can imagine if you have nausea and vomiting of pregnancy, you're not going to want to have sex in the first trimester. But, definitely that will fluctuate throughout the pregnancy. Sex can't harm the baby, as we discussed. It's not dangerous. It's actually healthy. And as long as the doctor says it's okay, so there's some very few exceptions to this rule. For example, if you have preterm labor or you're having problems with placenta previa or something like that, sex may not be recommended for you. So always check with the doctor if there's any question as to whether that would be healthy for you. And bear in mind that semen actually contains prostaglandins, which are the same chemicals that are found in the agents we use to induce labor. So you may notice some cramping after sex, and that's normal. If that bothers you or it's uncomfortable, you can always have your partner ejaculate outside the vagina, and it's not as uncomfortable for you. After delivery, we universally want you to wait on sex just because everything is healing and going back to normal. We really like to see you in the office between 4 and 6 weeks after delivery, check out anything, any repair that needed to be done, or if there's any extra bleeding. And after the doctor sees you, then it would be okay to resume sex.
Okay, thank you. The other issue that was a really big deal when you think about our grandmothers and grandmothers and was the baby blues, right? People always talked about the baby blues. And the question is that normal? And what is it about pregnancy and delivery that makes people feel sad? So Dr. Alicia, can you tell us a little bit about the baby blues and postpartum depression and things like that?
Sure. So baby blues and postpartum depression is kind of a spectrum of the same thing. Baby blues is just a very kind of mild form of it. And if you think about it, like the hormones are kind of raging when you're pregnant, and then they kind of drop afterwards, and that can cause a lot of the issues that women are having. But also, you just had a baby, so you went through a traumatic experience. You're probably exhausted just from that. And then you have a baby that doesn't really understand night and day and doesn't really sleep. And you have to feed that baby either with a bottle or breastfeeding, which is physically and mentally it can be mentally exhausting. And this can cause a lot of emotional turmoil in a woman. The mood swings, anxiety, difficulty sleeping because the baby's not sleeping. Very common. Postpartum depression is something that happens, and it is not something that anyone should be ashamed of. We do a postpartum depression scale when you come to the office at your 6-week visit, and sooner now. Now we start doing it 1 to 2 weeks afterwards. You might get a phone call from the doctor's office asking the questions. And it's important to be honest, because if, like, let's face it, you understand the questions, and if you're trying to hide it, you're going to be able to hide it. Try not to hide it, because we can help you. You might not need medicine, but if you do need medicine, then you should be willing to take that help. If you have a history of depression or a history of postpartum depression with other pregnancies, much more likely to have it again, and that's okay.
Right. So what about the elephant in the room, right? COVID-19, and there's so much out there, whether it's true or not true, about COVID-19 and pregnancy. You read so many conflicting stories. It affects the baby. It doesn't affect the baby. You can have a miscarriage. There's no effect at all. My word, like, what is actually true? Dr. DeLuca, can you review for us some of the issues about COVID-19 and pregnancy?
Sure. I think I agree with you about the elephant in the room. I think everybody, whether you're planning to get pregnant or whether you are pregnant, this is probably one of your main concerns. The good news about COVID-19 is that it's not primarily affecting pregnant women like, remember, Zika virus was affecting women that were pregnant. Right. All of us are vulnerable to COVID, and especially pregnant women who are immunocompromised. They're considered immunocompromised because they're pregnant. You want to just use the same precautions that everyone's using, socially distancing, wearing masks in public, washing your hands frequently, washing surfaces with antibacterial soap, avoiding people who are sick. I mean, those are the important things to do. Things you can do in pregnancy that would help bolster your immune system: getting plenty of sleep, eating a good diet, doing your prenatal vitamins. There have been some studies that suggest that zinc supplement and vitamin D, both of which are safe in pregnancy, can have some effect against, protective effects against COVID. Also, a lot of women are asking me questions. They're nervous to get pregnant because they're not sure what's going to happen in the hospital. They don't know, will they be able to be with their baby? Will they be able to have their partner with them? And really right now, this is sort of on a day-by-day basis. I mean, what we can tell you right now in the hospital is that if you have a planned delivery, either a C-section or an induction, we are bringing you in 3 days before your delivery and doing a COVID test on you. If you come in spontaneous labor, you'll be tested when you arrive in labor and delivery. COVID positive moms will definitely be asked to wear masks, and we will wear masks around you as well, but you can breastfeed when you have COVID. You can either wear a mask and breastfeed the baby yourself, or you can pump and provide, either have a family member feed the baby with a bottle of the pumped breast milk, or you can feed the baby. But the COVID does not cross the breast milk, so it is safe to do that.
Good. And we know that the risk of transmission from the mom to the baby is very low. So that's wonderful news. Out in Inspira, we really advocate that you choose your birthing experience, right? We want you to, our motto is own your birth experience. So you need to think about what's important to you. Who do you want in the delivery room with you? We are allowing a person in the delivery room with you. You need to think about, do you want medications? Do you want to be comfortable during labor? Do you want to have natural childbirth? Do you want to have an epidural? Don't have an epidural? We have all kinds of different therapies that we can help you with. If you choose not to have pain medication or an epidural, we support that. We have aromatherapy and different modalities that help with that. You need to know ahead of time if you want to breastfeed your baby. Well, you don't have to know ahead of time, but it's good to prepare if that's what you want to do. If you're having a boy, do you want to have him circumcised? So you need to think about what's important to you so we can help you have the best experience for both you and your family. So the takeaway for tonight is hanging in there. You won't be pregnant forever. All of the off-limit foods and activities will soon be available to you again. Be reasonable, trust your instincts, err on the side of caution. Don't believe everything you read. There's a lot of contradictory information out there, and you want to make sure that if you have a question or a doubt, as Dr. Alicia mentioned, call your doctor and ask them. We really want to have the opportunity to answer your questions. So we'll answer questions now as well. We do have a couple of questions on our list. Let's start with a couple of dietary questions that we have. So one of the questions that we have is, can you eat hoagies and cheesesteaks during your pregnancy? And another dietary one is, if you are on a keto diet or a no-carb diet, can you do that during the pregnancy? So I know, Dr. Alicia, you addressed the dietary issues during pregnancy. Can you answer those questions? You better be able to eat hoagies.
Deli is one of those things that's not really cooked, so you probably should stay away from the hoagies unless you want to like cook it first, which I don't know how good that will taste. Try it, let me know. The cheesesteaks, I mean, it's cooked. It's not necessarily the healthiest thing. You shouldn't eat it every day, but it's fine once in a while. Right. Keto, carb-free diet. So I personally believe that carbs, meaning like processed foods and refined sugar, is not good for anyone ever, pretty much. Not that I don't eat it. Again, I don't know what the right thing is to do. But like those kind of carbs is never helpful. A completely carb diet where like you're not having any fruits or vegetables or potatoes or rice. I mean, you can keep it low carb, and I'm not saying you can't be carb free, but it's not necessary, and those carbs will help with your energy during the pregnancy. So I would recommend a low carb and just complex carb diet than like a pure keto or pure carb free diet.
Right. So the issue about the hoagie is the deli meat. Is that right? That deli meats should be avoided.
Right. So anything should be avoided during pregnancy. So like sushi, unpasteurized cheese, like feta, raw meat, cold cuts, it's cured. It's not cooked. So if like when I wanted a deli sandwich when I was pregnant, I would heat up the deli first and then let it cool down and then eat it. So,
right. Okay. So that sushi, there was a sushi question. So you answered the sushi question. So that's really good. One of the other questions is, and either one of you can answer, what helps with loss of appetite during the first trimester?
That's a good question. I don't think that, it's not abnormal to lose weight in the first trimester or to not gain weight in the first trimester because you feel crappy. The hormones or, the estrogen makes you nauseous. The progesterone slows down the gastric motility, so you feel like heartburn and nothing digests. So, a lot of people talk about frequent small carbohydrate-laden meals, so like bagels or like, crackers. The other thing is ginger, things that are like ginger candy, ginger root tea, ginger ale. That will help soothe your stomach. There's kind of an old wives' kind of remedy that I always tell patients about. And I have had patients, and when I was pregnant, I thought it worked. It's not the healthiest, but you get one of the cans of fruit cocktail or peaches or pears that are in a can, and you drink the juice from that. And a lot of times that soothes your stomach too. but avoiding spicy and greasy foods, not a good time for pizza or for red meat, just anything that, a lot of people worry they're not doing enough fruits and vegetables in the first trimester. That will come, just eat what you can in the first trimester.
Right.
Yeah. Right. In the first trimester, you don't need to increase your calories by that much. So really, whatever you can tolerate, kind of what you're going to eat, and that's fine.
Right. Right. Another question, is there a difference between a multivitamin and the prenatal vitamin?
Well,
so Dr. Alicia, you can go ahead, Dr. DeLuca.
All prenatal vitamins contain folic acid. So that's what's in a folic acid, or that's what's in a prenatal vitamin. And they also, many of them contain DHA for the baby's brain development. So the multivitamins, I mean, a women's multivitamin many times has the same thing in it. I'm not really sure that there's a difference between prenatal vitamins and multivitamins, because that prenatal vitamins are expensive. They charge $1 million because they say their prenatal vitamins the best. So you have to be like a wise consumer about it. I've had women in their first trimester on a multivitamin that has folic acid in it, and they've done fine.
Right. You can just take the bottles and compare the labels to see what the real difference is.
Especially because, Dr. DeLuca's right. Prenatal vitamins are unbelievably expensive if they're not covered. I don't know if you
not often cover them anymore because you can buy them at the counter.
Right. So another question is, if your family has diabetes, will you be likely to get gestational diabetes?
It is one of the risk factors for it. Family history. And, if you have other risk factors other than a family history, like you're overweight or you're on steroids or you have polycystic ovarian syndrome, the ones that we mentioned, you may have to have, certainly when you come into care, we would test your blood sugar and we would test what's called your hemoglobin A1C, which is a measure of how much sugar has been in your blood system in the past 3 months. So you would get that when you first come into care, and then you might have an early gestational diabetes test, which is called a glucola, depending on your risk factors.
Okay. Something else to keep in mind about gestational diabetes is that if you do have it during pregnancy, you're at a higher risk to have it in a following pregnancy, and you're more likely to get it eventually when you're not pregnant. So you should be evaluated for that.
Right. We mentioned that one of the things that's important is going to the dentist. One of the questions is, what are the concerns? What are the concerns about dental health, and why is it important to go to the dentist?
Well, when you're pregnant, it's important to go because dental bacteria, if you have an abscess or you have periodontal disease, it can actually seed the bloodstream and you can develop preterm labor from having that bacteria in your blood system. So it's important if you do have an abscess or a rotten tooth or you're having an issue, a dental issue, that you do see the dentist. And it is okay to see the dentist when you're pregnant. We always tell people not to use certain medications in pregnancy, but you can have antibiotics with the dentist. You can have numbing medicine with the dentist. So it is recommended that you do get your regular dental care when you're pregnant.
Very good. Dr. Alicia, can you share with us some tips for caring for your mental health while you're struggling to conceive? That's a question for us.
Mental health while you're struggling to conceive. That sounds very difficult. Difficult meaning like I feel for them. That is a hard situation to be in. Trying to get pregnant is kind of that other elephant in the room. Nobody wants to see you having trouble with it, but at the same time, you might need help. It's not, talking about it with your doctor or a friend or your partner is important. You need to have someone that you feel like you can confide in. If you feel like it is such an issue that you need medication, which it really comes down to are you more stressed than not stressed more of the time, or more unhappy than happy? If you don't feel like going out and doing things you normally like to do, although COVID changes everything, so you can't do anything anyway. But assuming you can go out, then you might want to consider medication, which either your OBGYN or your family doctor. Not that I'm trying to push medication. I feel like that's what it sounds like, but I'm not. I'm just saying that mental health is important. And at least in America, we don't talk about it enough. We don't deal with it enough.
Right.
And we need to feel more comfortable with it.
Right. So there's all kinds of, behavioral health. If you feel like it's that much of an issue, we do have behavioral health centers that can help. But it's important to, as you said, just talk about it and make sure that, it's an issue for a lot of people. And one of the things, and I'm sure you experience this, is the more stressed people get about it, the more difficult it is then to conceive, right? I mean, we tell people, we find out so many times that after that pressure is off, people get pregnant, whether they have decided just forget about it for now, and then that's when people get pregnant. I think that's a real issue. So maintaining some mental health stability is really important. Here's a question. What about Flintstone vitamins?
If you do take Flintstone vitamins, and they're chewable, so they're easier to tolerate in the first trimester, I think you have to take 2. Yeah, I think the recommended daily dose is 2 of them once a day.
Okay. And you probably need to add folic acid, though.
Yes, they probably don't have folic acid. No. So did we address why folic acid is important in pregnancy? Did we talk about that?
I think we did. We said that it's responsible for closing the baby's spine, like the neural tube.
Right.
And the recommended,
so that's particularly important.
Milligrams a day of that. Certain women, have different situations with their health. If they're on like an anti-epileptic medication, they might have to take a milligram, not just 400 micrograms. 0.4 milligrams is what the dose is. I'm sorry, I might have said 400 milligrams. I meant 400 micrograms or 0.4 milligrams a day. But you might need more. If you've had a baby born with spina bifida before, you certainly need more than just the recommended.
Right. And it's ideal if you could start the folic acid 2 to 3 months before trying to conceive.
Yeah.
Okay, that's important. There's a question about our offices. Just so everyone is aware, all of our IMG offices, our OB-IMG offices, do offer everything in one. You can get your blood work and your doctor's appointment. In terms of the scan, if the reference is to the ultrasound, we have maternal fetal medicine departments that do that. So we have one in Vineland and we have one in Mullica Hill, and we have perinatologists or specialists in maternal fetal medicine that are responsible for the scans, and we have specifically trained perinatal sonographers who will do the scans. So all of our offices offer everything that you need, and again, the scans are done in a separate department.
And our perinatologists are from Penn, so they're really wonderful. They're great.
Yes. Yes, that's true. And we have those specialists in both locations. So, which is really good. And the good thing also about that is we can fit in a scan no matter where you are. So we have a really robust maternal fetal medicine program. And the last question that we have are what things should we pack in the hospital bag?
Ooh, during COVID? Everything except the kitchen sink.
That's true.
I will address that question because I did not know what to pack. I was at Target looking for like a nightgown and there was nothing. I ended up getting completely inappropriate things for my bag. But I tell people, make sure you have slippers, make sure you have comfortable underwear that goes up to your stomach, up to your belly button. Don't wear the micro minis or the little tiny, underwear, because you're going to get them dirty with blood and you're going to need to be comfortable. Wear either loose sweatpants or a nightgown, and, definitely a bra that is a nursing bra is helpful too.
Right. Very good. So we have a couple of questions related to classes and tours. We are working on virtual for everything because right now we are not doing in-person tours, but we are working on virtual. So we can, for those 2 questions, we are doing virtual. So So thank you. I want to thank Doctors Alicia and DeLuca. You did a fabulous job. They are obviously part of our family of accomplished providers, and we're really pleased to have both of them. They're both available to see patients at Inspira Medical Group. Dr. Alicia is in Vineland, and Dr. DeLuca is in Mullica Hill in West Deptford. We are seeing patients in person, and we're also seeing people via telemedicine if that's what we need. Our next Spirit of Women event is October 13th. It's entitled Aches and Veins, Your Vascular Health Matters. We are featuring Dr. Holly Graves, who is part of our Inspira Medical Group as well. If you're interested, you can register right here on the console before you exit tonight. And as usual, I need to thank our silent partners, who tonight referred to themselves as ninjas. We have a group from our marketing team who helps us do all of the planning and teamwork that gets done behind the scenes for these events. So thank you to Suzanne and Plaskett Bauer and Lauren Clinton for their work in helping put these programs on for you. So remember, stay home when you can, wash your hands, wear your masks, stay 6 feet apart so you can stay safe. And we want to thank you for participating tonight. We really appreciate it. So good night.
Thank you everyone for coming out. You're staying in.